Yeah, we're gonna go ahead and start the tummy tuck on this lady first because she does have a big hernia there. And so I think we're gonna address the hernia first and then we can put the implants, okay? I think that's the best way to go. So we're gonna try and limit her incision also to around here. And then notice the complete absence of bleeding when we do this. This is just incredible surgery. And you see that? Beautiful. Absolutely no bleeding here at the Cosmetic Surgical Center of Cerrito. Thank you. Wow, so look at this beautiful anatomy here at the Cosmetic Surgical Center of Cerrito. This is the abdominal wall fascia right there. And you can see how we can do this in a completely bloodless manner here at the Cosmetic Surgical Center of Cerrito. It's just absolutely beautiful. The little blood vessel there. So this is a bloodless technique, the Patino method, and it is absolutely beautiful. You can see the very small amount of fat that she has. So this is superficial fat. This white membrane right here is Scarpa's fascia right there, and this is deep fat right here, and this strong membrane is the abdominal wall fascia. That's the one that covers the internal organs, but what you don't see is any bleeding. See, normally with the traditional technique, this white thing would be totally red. This yellow thing, the fat there, the deep fat, it would be totally red also. This is Scarpa's. You can rarely see it because everything is red. This white membrane right there that separates deep fat here from superficial fat. And you can see this blood vessel here, so I'm gonna electrocoagulate it right in front of your eyes. And you can see it thin. There's no bleeding at all. You see that? Absolutely gorgeous because we identified the blood vessels. How do we do that? Because of the technique. The surgical technique is number one. And of course, the contrast. You can see the contrast. See? I can see the red or purple blood vessel up against the yellow fat or the white fascia, so I don't let anything bleed, even the little capillary. See, I go out after every little thing, and this is literally a lesson in anatomy. Look how gorgeous this is, absolutely gorgeous. Are you giving it a nice, look how beautiful this anatomy is. Now, okay, you see what I'm talking about? You see that purple blood vessel right there, see? There's a little capillary right there, and then you can see the very purple blood vessel right there. You see it right there? I'm gonna grab it and see, we're gonna electrocoagulate it right in front of your eyes. You see how it blanches? See? Now it's not purple anymore. Now we can safely go through it. You see, but that's a big blood vessel. You see it right there? And yet absolutely no bleeding here at the Cosmetic Surgical Center of Cerrito. So this is a special technique, really. It's what you tell the patient, not to take any aspirin-like medications, no vitamins, no herbs of any kind, and we do that basically 2 weeks before and 2 weeks after the procedure. It's also what the surgeon does. The surgeon does not give any enoxaparin, no blood thinners, no aspirin, no herbs of any kind. With the traditional technique, the surgeon routinely gives blood thinners, right, and enoxaparin and sometimes heparin and aspirin. Yeah, so you're not going to be able to do this, no way, right? And we'd never do that. We select our patients properly. We don't operate on patients that have a tendency toward blood clots. And this is how we do it. This is just incredible, right? And our patients, you can see them walking 1 mile the first day, 2 miles the second day, 3 miles the third day, precisely because they don't have any pain. They don't have any pain because they're anesthetized for the first. This is a perforator right here and another perforator. You can see the little holes. The arteries perforate through these blood vessels perforate, right? And that's the little hole you see, the artery perforating through the white and. So these are perforators, these are arteries that perforate through the fascia, so I'm charcoaling it down. See, I don't let anything bleed. This is just incredible surgery. And notice how we're also retracting with our hands. It's Sylvia's soft hands that retract. And look you see close into here, you see this artery here too. It's another perforator, and we're gonna basically get it without a single drop of blood. This is clean and beautiful. Look at that. And now this is the belly button area, and we're gonna go all the way down. See, you see absolutely no bleeding here at the Cosmetic Surgical Center of Cerrito, but this is definitely a different technique. See, I can see, why don't you show them the blood vessel, these blood vessels that I'm going to electrocoagulate. See, I electrocoagulated, I see it, and then I go through it, even if they're little capillaries. So the most important thing really is the technique. This is a unique technique that I developed in 2004. So it served my patients well, and it served me well as well. So no bleeding, there's no, and this is showing these blood vessels. So I'm electrocoagulating this blood vessel. See, and this patient really doesn't have any significant excess fat, right? So she's doing it mostly for excess skin, this area. Look at this, absolutely beautiful, right in front of your eyes without a drop of blood. Unbelievable. Thank you. So this is the area of the belly button. This is just incredible. Again, absolutely no bleeding. I take care of the blood vessels. So with the traditional technique, what happens is that you basically cut the blood vessels, then you're trying to find the blood vessel, right? Here, no, we see them, we stop them from bleeding, and then there's absolutely no bleeding. It's incredible. This is just beautiful, beautiful surgery. So with the traditional technique, what I was saying is that you use these cat paw retractor. It's called, looks like literally a cat paw with sharp metallic teeth, right? And this is what, instead of Sylvia sultans, this is what is usually used. And just by putting that retractor, it will tear the tissue. So we don't use that, right? So it's many things. And then of course the tumescent anesthesia is huge. I mean, so what you can see, this fluid here is the numbing medicine, and that numbing medicine is going to basically stay in her system for 2 more days. So that's why you can see our patients on TikTok walking extremely well. The very same day after surgery, they walk 1 day the first day, 2 miles the first day, 1 mile the first day, 2 miles the second day, and 3 miles the third day, preventing a blood clot. A blood clot is a thing that can kill you, but the very best way to prevent a blood clot is not enoxaparin, it's not heparin, it's not aspirin, it's not all these medications. The best way is for the patient to walk, and as she walks, she is going to pump the venous blood return. You see another blood vessel here. You see it right there? So I'm going to give a close-up on it. It's an artery. And if I don't see it, if all this is red on red, I would not see it. And of course, there's going to be... So I'm going to show you something. So this is the belly button, right? And this is a hernia. This whole thing is a hernia, right? So instead of me doing the tunnels, because that's where the hernia is, on the way of where the tunnels are, I first identified the hernia, and it turns out it's smaller than it looks, but of course it's because the patient right now is paralyzed, but this thing can pop up, when she strains. So now we're gonna reduce it first, and then we'll take care of the breast. Thank you. Now I'm gonna reduce it. Okay, I'm gonna put it back where it belongs. So this is a piece of fat that came out through a very tiny hole, right? But you may think, oh, that's nothing. Well, this is the most dangerous one, because the hole is so small. If this thing pops out, and intestine can pop out through it, then it would choke the intestine, and the bowel may die and could become an emergency. So we're gonna already reduced it, right? We put it back where it belongs. There was no bowel that we could see, and now we're gonna close this hole, end of the story, and then we're gonna do, that's one repair, and then we're gonna do 2 more on top, so this will not come out. And it's incredible. Thank you. And you may say, well, why is this dangerous? Well, I'm gonna give you an analogy. It's like choking, right? Like when you choke, if the opening is small, it's easier to choke, So we did a figure of 8 here, and so we're gonna close this hole. But obviously, if the opening is bigger, then it will not choke the bowel. So let's say, but this tiny opening in the fascia, and this is a congenital defect, something that she had since birth, and of course allowed that fat to come out, and it was this big, so that much came out, right? Like a ball there, but it came through this tiny hole. If the hole was big, then it's no problem, it's not gonna choke. But a tiny hole to allow this big thing to come out, it can eventually choke it. And as you get older, it can become a problem at any time, but especially if you get older and you have some pain and you don't recognize that your bowel is dying. Anyways, so we took care of it, and now we're gonna do the breast. Thank you. All right, so I'm gonna show you the tunnels that I made, right? But completely bloodless. You see that hole in there? You see that hole? That hole goes into here, see? It goes right in there, see? That's my fingers all the way into the breast, see? My finger can go all the way up there, see? That's my finger right there. And the same thing here. So I made the tunnel, it's completely bloodless. If you can come from this side, you can see the hole. I don't think you can see the hole from that side. You can see, I put my fingers, you see my finger there? And I go all the way, and I can literally just go right under that muscle there, and it's already dissected, right? But that's my finger right there, you see? And my hand, see my hand right there? My finger goes all the way up there, you see? That's my finger. Incredible. So that's the same thing that we do with the instrument, and it's absolutely bloodless. Thank you. So I'm using the Patino mammary implanter to put that implant right under there, and I'm gonna go ahead and inflate it, right? So you'll see how, we're just gonna put air because this is just a test implant. So we're gonna inflate it to 50, you can see, and 100, and you can see that implant already inflated. And so now I remove the Patino mammary implanter and now proceed to inflate that breast. So we have, right now we have 100, right? And so now it's 150 and 200. And that's all she wrote. That's what she's gonna have, right? Beautiful. So small breast, but beautiful. Thank you. This is how she came. She's pretty flat, and this is how she end up gonna be. I'm covering the nipple for social media, but absolutely gorgeous. Thank you. So that's the test implant. So I'm gonna go ahead and inflate it with air, 50 and 100. And now at the count of 100, I'm gonna remove the Patino mammary implanter. It's an instrument that I designed. It's a modified sponge forceps. And look at that. That breast is already looking beautiful at 100. And now we're gonna give it 150 and 200. You know what? I think she chose fine. You can see the tenting of the pectoralis major muscle here and the almond shape of the breast, meaning that it's under the muscle. Of course we know it's under the muscle, but that's characteristic of the under the muscle placement. And those are the sizers, and now we'll go ahead and put the silicone implants. So we just want to test to make sure that we can see the breast looking very nicely. Thank you. It's a little different from what you've seen me do because obviously this is a transabdominal approach. Actually, this is how I first started doing these cases, right? And look at that, absolutely bloodless. So this is the sizer. Look how flat she is compared to the other side. So this is basically the test implant, if you would, and the valve is down. So I'm gonna go ahead and see if I can do this by myself. Usually I have Sylvia helped me, but look at that, absolutely gorgeous. How long did that take?
Seconds.
Yeah, amazing. Thank you. We'll do. So this is the sizer, so I'm gonna go ahead and take it down with my hand. So, and you're gonna see how it's mostly with my non-dominant hand, and look at that, comes out completely bloodless, right? And I'm gonna go ahead and see if I can do this on my own. The valve is down, Cerrito. The valve is on this side. Oh, there we go. So that's the valve. So I wanna go ahead and propel this implant. This is the Keller funnel, but I want to make sure that the valve is still here. Okay, so I want to go ahead and propel that implant into the pocket using the Keter funnel, you know, and let's see if it's gonna go in. There we go. So that's your transabdominal silicone breast augmentation, and this is how I actually learned, or the inspiration to this procedure came through doing it like this when we do a tummy tuck. And then I figured, you know, it's actually easier to do it through the belly button the way we usually do it. But those are transabdominal. This is what I've been teaching since 2014 through this approach. But then, of course, I discovered how to do this through the belly button, and it's actually easier with the technique. Thank you. All right, so we set her up and we decided we're gonna go a little higher. So you mark twice and then you go here, and I'm gonna finish the incision. I wanted to go low, but I think she needs it. I had her sit up and I realized otherwise she's gonna have excess skin. She's gonna have some dog ears on that side, you know? We don't want no dog ears, so we have to make the incision bigger, right? I'd like to keep it nice and low and very, but if you compromise on the scarlet blood vessel there, then she's gonna have a dog ear that's gonna be excess skin. So no, let's take it out now. We don't have dog ears here. We don't like them. Thank you. This is how we do it. So look at that, absolutely beautiful, 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 beautiful anatomy. Very translucent. You can see everything, right? It's absolutely gorgeous. So no bleeding here at the Cosmetic Surgical Center of Cerrito. It's a little blood vessel there, so I electrocoagulate it. So then I don't let anything bleed, see? I don't let anything bleed. Look at that. It's another blood vessel. But I see them. I mean, this is pretty unique surgery, you guys. I mean, go look at any other surgeon doing this. You'll see how unique this surgery is. It's incredible. A lot of it is the operative technique. That's the part that's difficult to teach, because the doctors, they just want to go very fast. They do many cases in one day. We're just doing one case or two cases at the most. That's it. And that's how we do it, you know. But very meticulous to the point of being ridiculous. See? And notice how everything is absolutely gorgeous without a drop of blood. Look at that wound. And look at this. She doesn't have much. But all these stretch marks bother her in the excess skin. She looks absolutely beautiful. And no scars on her breast. Transabdominal silicone breast augmentation. Thank you. Alright, so this is the right side, right? So again, look at this. Can you see the inside? We're doing this in a completely bloodless manner. See that? Incredible. Okay, and then we go. And we take our time, just slowly enjoy the surgery, right? So there's no stress. No stress on the surgeon, no stress on the anesthesia provider, no stress on the nurses, right? And obviously we want to keep the patient stress-free also, right? So not much fluctuations in the blood pressure or anything like that because of the tumescent anesthesia that we have to, and the lack of bleeding, so it doesn't cause stress on the patient, right? So look at that, it's absolutely beautiful. So this is what we do, see? So the stretch marks, this is just the marker, the purple marker. But, you know, look at the absolutely bloodless wound. Thank you. What is this? This is the hernia that she had, right? It popped out that big. So it's substantially big. So I was concerned. So that's why we decided, you know what, that is in the way of the tunnel. So let's just do the hernia first. I think it was a good move. Although the hernia was small, and because the patient was paralyzed, in other words, she wasn't straining, she couldn't strain because she was paralyzed. I asked my anesthesia provider to basically keep her paralyzed, right? So that we can avoid this hernia from popping up, you know? And it didn't, right? So that's good, but still, I mean, I think the safest thing to do is I changed my approach from a transumbilical to a transabdominal. And now you got to see a transabdominal breast augmentation, which is literally how I started doing this procedure. So it was just through the the flap once we're doing an abdominoplasty or a tummy tuck, then I will put it just like that. But you know what? I'm so used to doing it through the belly button, and I tell doctors that the best way to do is to learn it through the belly button, because it's actually more difficult to do it. It would seem like it's easier, but it's actually more difficult because of the, you know, this flap has like a, it acts like a pulley, right? It's difficult to explain, but so you can go in the correct pocket. It's easier to do it that way. But anyways, it's refreshing to do this, and I think we did the right. But see this blood vessel right here? Look, so I'm gonna electrocoagulate it. You see it right there? You guys see it right in my glove? See? So I'm just so meticulous, right? That's beautiful. See? So I literally, that's my glove right there, and that's it. What are you doing with that?
I'm pulling the area with room temperature and all sealing.
Exactly. Thank you. Pull that up, and you can see the hole in here. I don't know if you can see because it's not 3D, but you can see the hole here. That's the rectus diastasis. It's basically a hole, a separation of the rectus abdominal wall muscles that separate during pregnancy to make room for the baby to grow. And normally when you do this rectus plication and you put this stitch right here with the traditional technique, there is significant bleeding. Every time you go through like this with the needle, a lot of bleeding, and of course this will be completely red, right? And this is not a bruise, those are just the marking lines that I put to depict the muscles. And so I'm gonna go ahead and put this other stitch right here, you see, and I avoid the arteries. See, I avoid the arteries, and this is what is called a figure of eight. It's the same stitch that we did here, figure of eight for the hernia. And so now this is what we're gonna do. We're gonna cover that hernia twice, right? And then we'll cover it again. So that's the first repair, and this one here is gonna be the second repair, and then we'll do one more. So make sure that that hernia doesn't recur. And the beauty, she has her own natural tissues. She's not going to require a mesh or anything like that. And I think we're gonna save her a problem down the line as she get older, as the tissues relax. That hernia is probably gonna get bigger, right? And not anymore, because it's not gonna pop out, I don't think. I mean, these hernias can recur, of course, and but so far we have the patient's natural tissues, and it's just unbelievable surgery. It's completely bloodless, so she's not gonna need a drain. This is just many advantages to this approach. I'm gonna remove this little piece there, but I'm doing this before your eyes, right? And we're getting close to that hernia repair. And you'll see how we're gonna cover the hernia repair. That's the hernia repair right there. And this is number 3, 4, 5, and 6. We do 6 knots on the O proline for those doctors watching out there. And this is the second coverage of that supra-umbilical hernia repair. And I'm gonna measure exactly how far from the root of the belly button that hernia was, and we're gonna say it's 4 centimeters above the umbilicus for our operative report. And now we're gonna basically grab this rectus abdominal wall fascia, and this is the area of the repair. So I'm gonna be a little more generous to give it more coverage here, and I'm gonna go ahead and push in those knots so that they don't show, right? And so you see how beautiful this is gonna be, basically the second coverage. And the reason why we changed from transumbilical to transabdominal silicone breast augmentation is because I didn't wanna, if there was bowel coming out, I didn't wanna run into that bowel. And thanks to God there was no bowel. Thanks to God it was a pretty small opening, and but still. So see now, this is the second coverage for that hernia with the rectus plication with her own tissues. Look how beautiful this is, right? And otherwise she would have required a scar, to repair this hernia this way. There's no scars. No scars on her breast, no scars on the inframammary folds for the breast augmentation, and beautifully, no scars on her belly because on the belly button. So because she's only going to have a bikini line scar. Otherwise, she would have a scar right here, like a scar here or around to get that big thing. See, she would have had a scar here. Now you're going to have a beautiful. That's the belly button that's going to come out of there, right? And she's going to have a gorgeous belly with no scars, only a low bikini scar. So this is the way to go. And now, once you come from the side, so you can see she doesn't have a lot of intra-abdominal fat, but all that is the rectus diastasis, the separation of the rectus abdominal muscles, and all that is internal fat. She does have fat inside, and that fat is associated with diabetes. So we're going to push it in. At the end of the day, we're going to show you how nice, flat, and tight she's going to be. Thank you. All right, so we have the second coverage, right, of that, and now this is the third. So this is running or proline sutures, and of course the hernia's up there, but we're gonna cover it. I'm just showing you how we do these. So she's already nice, flat, and tight, and so these sutures just for extra reinforcement, right? So most surgeons just do one, right? And they can do running or figure of eight. So we did, for the rectus plication, we did a figure of eight first that you saw, above and below the belly button, which is right there. And now we're doing another coverage. So it's a second rectus plication for more safety, especially in this patient who's an athlete. And I predict that she's gonna be doing exercise and all that, so we want to leave her super tight and no chance of this breaking down, right, with an effort, especially since she has some significant intra-abdominal fat. It's not a lot, it's just mild intra-abdominal fat. It's normal, that fat that is around the intestines, inside this membrane, and you saw that part of that fat came out in form of a hernia through an abnormal opening in the fascia from birth usually, but when you do exercise, especially if you lift weights or you do some effort, that thing can pop out and be as big as this. As you can see, she had a bulb there and I didn't know if it was fat or bowel. That's why we decided it's better and safer just to do a transabdominal silicone breast augmentation, take care of that hernia first and then do the breast instead of going through the tunnel there. I think it was. All right, so what you see here is the root or the stalk of the belly button, and we don't want to choke it, but we just want to make it tight, and so that it allows a finger, that opening right there. And so this is all proline, 2 and 3 and 4 and 5 and 6 knots on the proline, and then I'm gonna hide it there and inside, and we're gonna cover that so it doesn't stick out, especially because she is skinny girl, right? So we're gonna cover it in there, and we're gonna do now the repair. Well, you cannot even see the hernia repair. It's around here, but it's already covered. So that's the coverage from the rectal, from the hernia repair, the rectus plication, and now we're gonna do another one. We're gonna cover this whole thing. Thank you. Putting this knot inside right there. We're closing now all the way up to the end of the chest bone. That's called the xiphoid process, all the way up there and all the way down to the pubic symphysis. That's where the pubic bone is and the pubic hair is. So it's a long plication above and below the belly button right here. Let me show you. The belly button looks like a little mushroom, you see? That's kind of cute. We're gonna trim it, make it look better, and fit the size of the outside opening. And this is how we do it. So what I was talking about before is that now that hernia not only has been reduced, not only the hernia has been repaired, but has now coverage that is double coverage, from her own tissues. And we're gonna do the same that we did on the other side, and we're gonna give it here 6 knots, and 2, and a 3, and a 4, and a 5, and a 6, and we're gonna hide it in there. See? You hide it so it doesn't stick out. See? I'm gonna hide it in there. See? Beautiful. Gorgeous. Thank you. So now we're gonna go ahead and trim that edge of the belly button to shape it in the way that the outside is, and look at that. So I'm cutting with scissors. You see that? I'm cutting with scissors, and yet you may say, oh, the technique is because of the electrocautery, and you know, some doctors think that my electrocautery has something special like laser or radio frequency. It doesn't have anything. But see, I cut with scissors, yet there's absolutely no bleeding. Look at that. Thank you. I was gonna finish the incision here, of course, but look, there is a little dog ear, so we're gonna take it out. So I don't like dog ears, so even if you do liposuction there, which she doesn't really have any excess fat, if you do liposuction here, there is still gonna be excess skin, so we're gonna take this excess skin out. Unfortunately, well, this scar's gonna be a little longer, but no dog ear here. Thank you. Alright, so this tiny dog ear, right, that we take out, right? So it's important because otherwise she'll have a bulge here. And now she has no excess skin, no excess fat, and a little longer incision. Thank you. Wow, look how athletic she looks. She looks absolutely beautiful. Very athletic with zero liposuction. And look at the breast augmentation, silicone, breast implants, no scars on her nipples. We're covering the nipples for social media. No scars on her breasts, no scars on her armpits. We went through the abdominoplasty incision. It's called a transabdominal silicone breast augmentation. But she looks absolutely gorgeous and no drains, okay? So this is the low cut incision at the level of the bikini with zero drains. Here at the Cosmetic Surgical Center of Cerrito with Dr. Gabriel Patino. Thank you.